Ordered to Care: The Dilemma of American Nursing, 1850 to 1945, by Susan M. Reverby. As the title suggests, Reverby examines nursing for almost a century, looking at a profession whose humble beginnings represent a labor of caring that began as woman's work for family, friends, and community. What began as skills learned through an informal education passed from mother to daughter has evolved into the formalized education of professional nurses. Even with these educational changes, the obligation or duty to care still plagues nurses in today's workplace. Reverby argues that nursing was shaped by an obligation to care. This obligation to care helped grow and shape nursing, but also constrained nurses' control over their own practice and future growth. Reverby uses the stories of nursing through the years to bring to life the evolution of today's nurse and explain issues that nurses face today. History as pedagogy. History shapes our identity. Examples used by Reverby include women's obligation to care for family and community, and belief that this obligation and duty bind the nurse to her patient. Difficulty defining nursing roles and the development of different types of nurses. History as evidence. History gives a voice to those of the past. Examples used include nurse-to-patient ratio, women that were underpaid and overworked with no recognized standards of nursing load, nurses becoming task-oriented instead of patient-oriented, the realization that when work pressure becomes too great, the quality of nursing care decreases. History as explanation. History ensures that we don't look at an event in isolation and helps us understand why things are the way they are. Examples include bullying or abuse of nursing students and new nurses, or lateral violence, the struggle for autonomy and the paternalistic relationship with physicians and hospital administration, and the existence of long shifts to provide care for patients. Reverby makes one important point that she opens the book with and closes the book with. The value of caring need not be undervalued.